Hi, physiology students. Welcome to the next lecture on Chapter 4, Part 2, the Central Nervous System Physiology. So I'm going to share my screen and we're going to pick up on the PowerPoint where we left off. Okay, so what we are going to be covering today is the meninges of the brain. These are membranes that cover the brain. There's three of them. The outermost and thickest and toughest membrane is the dura mater. So on this image, it looks like it's a light pink right here with the arrow pointing toward it. That is the membrane that is just underneath the cranial bone. Okay. All right. The next layer is the arachnoid mater, as indicated by this bright pink arrow. And that is a layer underneath the dura. And it has in here a subarachnoid space where the blood supply to the brain is located. And I'll talk about the significance of this blood supply soon when I talk about brain hemorrhages due to brain injury. Okay, now the last and innermost layer is the pia mater, and it is indicated by this white arrow. So this is the membrane that directly covers the brain itself. Now, in this pia mater, there is a blood-brain barrier, and it will allow some substances through, like the gases, oxygen, CO2, glucose, and other nutrients. And that substances that are in the blood supply of the arachnoid mater diffuse across that pia mater, and those astrocytes are functioning as part of that blood brain barrier. Now, the concept here is that there is no direct contact of your blood supply with the brain. What happens is all the goodies from the blood supply diffuse across the blood brain barrier and get incorporated into an ultra pure fluid that bathes the brain, the cerebral spinal fluid. Okay. Okay, but some things easily cross through this blood brain barrier. As I mentioned, gases, nutrients, and things like that. But also, some other things can diffuse across that membrane. And when they enter the brain, you can see central nervous system effects. Well, one of those is alcohol passes through very easily. Nicotine from cigarettes passes through, caffeine. Tetrahydrocannabinol, that's the active ingredient in weed, basically, and general anesthetics, the anesthetics that you take when you're going through surgery and you want them to go through the blood brain barrier so it can knock someone unconscious for general surgery. Okay, so let's talk a little bit more in the next slide here about the blood supply to the brain. So in this upper right hand image here, you're looking at a brain where this is what the subarachnoid space would be. And you see all the blood vessels that crisscross the brain. And down here, what you have is a plastinated um, vasculature of the brain where all the other tissue has been dissolved away. And you can actually see the halo of the brain by how much of a blood supply the brain has. So the brain is very metabolically active and it uses about 15% of all your arterial blood, just that one organ alone. 50% of your blood glucose goes to your brain. And if the brain experiences even a brief interruption in blood flow, and an interruption in blood flow is called ischemia, without that gas, the oxygen, and without the glucose, brain tissue would quickly die because its metabolic rate is so high. It has very heavy demand for oxygen and glucose. So, what can happen if there's a blood supply loss to the brain? That's called a stroke. And depending on how long that part of the brain goes without blood supply will determine how much tissue death there is and if it's something that's incompatible with life. So, in the lower left hand image here, this is a brain that's been removed from a patient that died. And the dark area right here is neuronal tissue death from a stroke, an ischemic stroke. And obviously, this is probably what killed this patient. Okay, so when someone is having a stroke, it's important, vital that it be identified as one and get medical care as quickly as possible so that you can reestablish blood flow. Okay, so a stroke is one problem that you can have in the brain, and it's an interruption in blood flow. You can also have damage to the brain that involves blood, but it's a blood hematoma. Okay, so we'll go to the next slide here. So, cerebral hemorrhage. Okay, a pocket of blood called a hematoma forms in the brain. okay, or can form under the duramater. People have heard the term subdural hematoma. Well, really, what is that? Well, if you get blunt force trauma to the head, okay, you could get hit on the head or fall. And all those blood vessels in the subarachnoid space, they could become ruptured. And what will happen is they will keep bleeding and pouring blood into a pocket. And if a hematoma forms under the duramater, that was the tough membrane that's just under the cranial bone. If you get a bleed there in the subdural space, that pocket of fluid, as it gets bigger and bigger and bigger, builds up tremendous fluid pressure. It's like hydraulics. Now, if it's under the duramater, that membrane is so tough, it's not going to tear. And that pressure is going to go out in all directions. It can't push on the cranial bone because the bone is too hard. In an adult, the sutures are fused. So that pressure has got nowhere to go but out to the sides and down and oppress on the soft tofu like consistency that is the brain. And the more the pressure builds, the more likely tissue is going to die from pressure necrosis. Okay, so up in the image here on the upper right, that's a subdural hematoma. Now, in the image on the lower right here, this is a cutaway view of a brain from a patient that didn't survive an intracerebral hemorrhage, and that is a hemorrhage that formed deep inside the cerebrum. Now, people get subdural hematomas quite frequently from a fall, a car accident, or they get hit on the head. So I'm going to show a video here, a YouTube video, and I do want to warn it's got graphic content. So if you're a little squeamish, you might want to step away. But if you're planning on becoming future nurses, it's probably a good thing to see. But I did want to give that graphic warning. Okay, so we're going to look at this video. It has some kind of obnoxious music to it, but very dramatic music. So the patient was an 83-year-old woman. She fell, and CT scans of her head showed a left acute subdural hematoma. All right. So they performed a craniotomy. So here's the CT scan, and here is the hematoma. It's a large one on the left side of her head. Notice the left hemisphere of the brain is being pushed over. All right. So they have to get that hematoma out of there. Here's another view, front of view. Here's the hematoma. All right. So what they're going to show is they've cut through the bone. They're going to lift off the top of the skull. They're going to make a little cut through the duramater so that they can get to the hematoma. So here's the skull cap. They've already cut through that. Okay. Don't worry, they'll put everything together again. Okay. Now this membrane that they're lifting with the thumb forceps, that's the duramater. It's so thick it has to be cut through. And the doctors aren't going blind. They know exactly where this hematoma is from the CT scan. So they're going to reveal the hematoma. It's that looks like red jelly, okay? And they're going to use irrigation to gently wash that hematoma off the brain so they don't use harsh tools. And then they're going to try and find the bleed. Okay. So I'm going to try and point it out to you when I can see it. There it is. That's the bleed right there. It's arterial, so it's spurting. So they're going to use electrocautery to seal that blood vessel. There's the blood flow. Okay. And then they'll watch it for a little bit, make sure they got it. All right, looks good. They'll put everything together. They'll probably leave a shunt in the brain to accommodate swelling that occurs after a surgery like this. But the surgery, she's an 83-year-old woman, and they say that it took 3 hours and she lost 200 cc's of blood. That's actually pretty good. All right. Okay, so welcome to your first subdural hematoma repair. Okay. So hopefully you're still with me now, and I haven't lost you to this kind of scary surgery. But these are the things as a nurse, if someone comes in with head trauma, you got to watch them like a hawk, because they could be fine and talking to you 1 minute, and then next minute they could crash. Because as that pocket of blood gets bigger and bigger, and that takes time, all of a sudden it could put enough pressure on them that they could lose consciousness. Okay, well, let's move on to something that's not so gruesome. Okay, so how do you do brain imaging without actually going into surgery and opening up the brain? Well, I'll go through some common techniques. One is, let me see, get rid of this little X. One is to do a plain old x-ray. If you have a fractured skull or jaw or any kind of fracture in bone, x-rays are the way to go because they're best for radiopaque tissue, and bones are radio dense. So they're going to show up as white on an x-ray, whereas soft tissue is going to be some level of gray, and air spaces will look black, like over here on the right. The lungs here look black. Okay, so x-rays are also the least expensive brain imaging technique. Um, don't worry about numbers and everything. It's just to give you an idea. Now, however, if someone's got damage to the head and it's soft tissue, like a hematoma, an x-ray is not going to do a great job of showing soft tissue. The detail won't be enough. So the other thing that you can do is a CT scan, like that woman who had a CT scan to show where her hematoma was. Now, so a CT scan is multiple X-ray beams as opposed to one X-ray beam in a radiograph. And so it sends it through different layers of tissue. And so you get many, many views going into a tissue all the way through. And then a computer puts all these images together, all these slices together, and you can get a really good two-dimensional image of what's going on, and you'll see soft tissue with much more clarity. So what we've got here is on the left here, a normal CT scan of a brain. And on the right, you see a intracerebral hemorrhage in the brain. Now, you would not be able to see this at all probably with an x-ray, but a CT scan reveals it. Okay, they're well, a lot more expensive than a radiograph, but you need them for soft tissue. Now, the best imaging technique for soft tissue is going to be an MRI, magnetic resonance imaging. So it uses a very powerful magnetic field and radio wave pulses to take pictures of a tissue. It's probably the most expensive imaging technique, but it is going to be the very best for soft tissue detail. The problem with an MRI, since it's a strong magnetic field, is if that person has, say, a pacemaker, or they have any kind of bone repair that involve titanium rods or anything like that, anything metal, cannot go through an MRI scanner. So there would be some limitations on what parts of a person could be scanned if they have metal implants anywhere in their body. Okay, a PET scan, positron emission tomography, is they will inject a patient with a radio labeled glucose. And what will happen is this will be a live scan. They're scanning a person while they're completely awake. And what they want to know is what parts of the brain are metabolically active and working and using a lot of glucose. Those areas are going to show up as light, as yellows and reds, and maybe even greens. Areas of the brain that are not metabolically active will be darker colors like the blues and the black. It can also show areas of the brain that should be active. If they're dark, it could indicate neuronal tissue death. So what happens is here on the lower right, we have a normal PET scan of a brain, and all the areas that are cortexes of the brain are very brightly lit, and that means they're active and healthy and working. When you start to have some mild cognitive function problems, like the middle image, you start to see more areas coming in as blue and black. And then on the farthest right is an Alzheimer patient, and you can see a significant part of that brain has basically gone quiet, very little neuronal activity. And that is probably pretty much permanent loss of neurons in that area of the brain. So a PET scan is good for lots of different reasons. Okay, the last imaging technique is an EEG. Now, this could be used in a sleep study clinic or when they suspect that there might be some other problems in the brain. And you don't have to memorize this, but you wear a cap with all these sensors, and then you have the patient actively awake, thinking, maybe talking or working, and then when they're relaxed, and then when they're sleepy or meditative, and then where they're deep sleep breathing. those waves are going to look a little different. So look at the gamma one, okay? Short, little, very frequent waves when you're actively thinking. Now, compared to when you're sleeping, look at how much those waves are stretched out and they have higher and lower peaks and troughs. Now, if you look at an actively alert person, they're awake, and you see delta waves, that could indicate they've got some sort of brain damage because you wouldn't expect to see delta waves in an awake person. Okay. Likewise, if you have an actively alert and thinking person, and you see delta waves, uh, that's a problem. All right. Well, anyway, so don't memorize the waves, but just know its use is it can tell you based on the types of waves you see when a person is doing different things. If you see abnormal waves, it tells you something's wrong. Okay, so that ends our third installment, third lecture. We'll pick up with the fourth one, and that will be next.